Hey John, how you doing today?
I'm alright.
All right. So I already talked to you about that we're going to be recording our session today. The main purpose of our meeting today, as opposed to our normal individuals, is we're going to talk about assessing you for trauma group.
Okay.
I'm going to talk a little bit about informed consent for the purpose of the video. If you're a danger to yourself or others, or if there's a danger presented to someone else, those are some things that I have to report. Otherwise, what we talked about today will be between me, you, and the rest of the clinical staff,
Okay.
as necessary. So, we're going to be assessing you for trauma group today based on something we talked about in our last session. Do you remember what that was?
A little bit, yeah.
So, you talked about something that happened between you and an older boy. And I wanted to hear a little bit more about your thoughts surrounding that.
I mean, it happened. It's over. I'm over it.
Right. And that's a common reaction. Usually people, whether they're in counseling or not, often things that happen to us in our past, we just kind of brush off like that's something that happened and we go on with our lives, but that doesn't mean that it hasn't affected us in some way. Sometimes we don't even know how it affects us. But it's always something that just warrants a little bit more looking into, especially when you're trying to accomplish a goal. So I know you've already been in our program for 30 days now. Why did you come to treatment in the first place?
Because I wanted to stop drinking.
Right. So when thinking about trauma group, one of the things we try to look at are possible underlying causes for what makes us want to drink or use or whatever the case is. Now, I know you said that the abuse that happened when you were a kid, that you're over it, right?
Yeah.
But, in my experience, I think sometimes that plays more of a part than we know. And like I said before, it's always good to look a little bit more into that. So, looking back on your drinking career, when did you start drinking?
When I was a teenager.
A teenager. When did the abuse happen with this other guy?
Around the same time, I guess.
Right. So when we talked before, you said it was a couple years after that you started drinking. Not many, it's like a year or so. And I get it. Sometimes it's hard to remember that a little bit. But I was wondering if you can, when you think back to that time after the abuse happened, how did that change? Like, did you have a lot of friends back then?
Before the abuse or after?
Before.
I had some.
And did your interactions change at all? We're gonna go this route. What did you like about drinking when you first started?
I was relaxed and funny.
Okay. So it made you more social.
Yeah.
Made you feel relaxed. Made you feel more funny.
I was funny.
Yeah, I think you're still funny, John. That's one thing I like about you. Funny in a good way, though. So, here, in addition to the substance use treatment, we have trauma group. And like I said before, trauma group kind of helps look at some of the underlying issues behind drinking. It's a small group, and it allows you to process, and it's facilitated by a licensed trauma coordinator. And I don't want to minimize your feelings at all around that, what happened when you were a kid. or even try to make you feel any type of way. I just think trauma group will help you to look at it. So we talked before a little bit about triggers and coping skills. What do you remember about that?
Well, you talked about triggers being why I drink. And I drink when I get mad.
And how about coping skills? Had you developed any coping skills for when you have a trigger? We didn't talk about it that long ago, so we haven't had that much time. But
I mean, I guess I could write about it.
okay. I have an assignment that might help you to identify some of those things. And we'll get to that in a second. But, so more recently, before you came to treatment, you were living on your own, right?
Yeah.
And you, most of the time, drank when alone.
Yeah.
Okay. How about cravings? The last time you had a craving to drink, when was that? You've been here for 30 days. I wouldn't be surprised if you had some triggers while you were here to drink, or cravings, rather.
Yeah, probably a week or so ago.
And can you think sometimes triggers are, you could be angry or sad or lonely. Do you remember having any of those kind of feelings the last time you had a craving?
One of the other guys in clinic pissed me off.
So you were angry.
Yeah.
Somebody else in the clinic pissed you off.
Yeah.
All right. And then you wanted to drink.
Yeah.
So do you think drinking would have made the situation better?
Probably not.
It definitely wouldn't have made it stay better. So anger would be an identified trigger for you to drink. Now in trauma group, sometimes when they talk about triggers and coping skills, when there's something that reminds a person of their past trauma, they might have, that might make them angry and then they want to drink, or it might make them sad and then they want to drink. Whatever the case may be, it's similar. Our main goal here, like you discussed, you came here to quit drinking. So we want to figure out the best way to help you achieve that. All the skills that you'll learn in trauma group, if you are appropriate for trauma group, will help you achieve that goal of not drinking. Now, we usually don't even start trauma group till after 30 days. So that's why we're assessing it now. In addition to the fact that we just started talking more about the childhood trauma. You've done great in treatment so far. You got your 30 days yesterday, right?
Yep.
Did you get a chip?
Yep.
So you've been going to the meetings?
Mm-hmm.
Awesome. That's an accomplishment. When's the last time you had 30 days sober?
It's been a while.
Oh wow. That's huge. I mean, that's a strength. I truly believe it's a miracle when people are able to sustain sobriety as long as you have already. And that goes back to another reason why we're going to look at trying to get every possible underlying issue addressed to try to help give you the best chance at maintaining that sobriety. So tell me a little bit about what your life looked like before coming to treatment.
I was alone a lot, either driving the truck or when I got home, off the road.
Do you like being alone?
Sometimes.
So tell me, so you're a truck driver. Did you do like over the road trucking? Would you drive from coast to coast or
Long
local?
haul.
Long haul?
Yeah.
It's cool. I could see how that would be lonely. Why did you like that work, or do you like that work?
I like the work. It's nice because I don't have to deal with people. People kind of suck.
Yeah. But so do you think drinking helps you deal with people?
I could tolerate them better when I've been drinking, yeah.
Tell me a little bit more about that.
I guess I just don't care as much when I've been drinking.
Yeah.
Yeah.
You know, and that's common, but you got to a point with your drinking where, you know, what made you want to stop?
Well, I don't want to lose my CDL, and it'd be nice to see my kids again.
When's the last time you saw your kids, John?
Been a minute.
How about, when you think back, when do you think's the last time you saw them?
I really can't even remember.
What, were you married
Yeah.
to their mom?
Yeah.
Okay. So what do you think, why did that relationship end?
Well, part of it was because she didn't like me being gone all the time. It was tough on her. Part of it was probably the drinking.
Yeah. So, but you do miss your kids.
Yeah.
I'm sure they miss you too. It's got to be a little bit tough. And again, I think it's amazing that you've come in here to get help. You know, that is definitely a strength. So, I wanted to talk to you a little bit about this assignment. Now, it's not tough. Well, it's tough in one way because you're talking about feelings and you're identifying triggers and coping skills. So this can be rough. And I want you to, as you're going through this, I want you to talk to your peers. You know, if you feel anxious or if it's getting hard, and you can take a break, and we can talk at our next session if this gets too tough for you. But so what this is, well, the title, Personal Hierarchy of Triggers, Safety Behaviors, and Avoidance Behaviors. Okay? So when we talk about triggers and coping skills, drinking would be an avoidance behavior. Because you get angry, you drink, you don't feel angry anymore. Safety behavior, those vary. You know, it could be separating yourself from a situation that makes you angry, or it could be looked at as a coping skill. But the purpose of this, primarily, so this is a secondary part, is going to be to identify more of your triggers and see and kind of rate them just as far as how they affect you.
Okay.
So this here is a distress thermometer. And what we call the rating are subjective units of distress, or a SUDS scale.
And what does that mean?
So that basically just means how much it bothers you. So there's some examples. So it goes 0 to 100. 0 would be totally relaxed. So if you saw a dog, do dogs bother you?
No.
You like dogs?
They're alright.
But it doesn't make you want to drink.
No.
And are you relaxed around dogs?
Pretty much.
All right. So maybe a dog might make you a little nervous. So maybe you might be at a 5 around a dog or something. So like 0 would be you're totally relaxed. Situation doesn't bother you at all. When you get up to 100, it's your highest distress, fear, anxiety, discomfort that you've ever felt. Does that make sense?
Yeah.
So, for some people, like one example they gave is going to a grocery store. Do you like going to a grocery store?
Not really.
Why?
People.
People.
People suck.
And there's a lot of people at the grocery store.
Yeah.
I totally get it. So in this example they give, grocery store for this person was a 50 on a SUD scale. So we got moderate anxiety, this means they're a little nervous, medium distress, not too bad. So they're able to do it. Uncomfortable, but can continue to perform. So you're able to go to the grocery store. Are you able to shop?
Yeah.
So maybe it falls in that same sort of area for you too. So let's start here. So when we're talking about, one of the first triggers we identified for you was anger.
Mm-hmm.
When you're angry, how badly do you want to drink? If you were looking at this scale on 0 to 100.
About a 90.
About a 90. Phew. Okay, so that would go, so when you look at this, so this is just a homework assignment, and I don't want, try your best not to let this stress you out too much. And we'll just bring it back to the next session and
You
we'll
don't
look
want the
at it.
distress scale to distress me?
Yes, exactly. Where does this assignment put you on the scale?
I don't know, somewhere in the middle.
It's like 50?
Yeah.
Why do you think that is?
Well, I mean, I'm gonna have to be thinking and feeling, and that's not something I really like to do. But I'm not super scared about it.
Right. Well, that's good. I'm glad you're able to do it. And like I said, if you want to take a break at any time, you can. So you said anger puts you at about a 90.
Yep.
All right. So we put anger up here in the top. The SUD's 76 to 100.
Mm-hmm.
And you just write 90 right here.
Okay.
Not too tough, right?
Mm-hmm.
Give me another example of something that makes you want to drink.
Crowds.
Crowds. Now, we had the grocery store at a 50. Where do you think crowds would be?
Maybe about a 60.
60.
Depends on the crowd.
What do you mean?
Well, if I'm at the ball game, I want to drink more people, and beer's there.
Now, does the ball game make you nervous, or is it kind of a habit?
More habit,
Or habit?
but the people make me nervous.
Okay. This is something I want you to complete on your own and bring it back to our next session. So I'm going to give this to you now. Questions about this?
Nope.
Pretty
I'm
cut and
good.
dry?
Yep.
All right. I'm going to talk to my supervisor and the trauma coordinator about possibly getting you into trauma group. And then we're going to meet again before you start. And we'll go over this assignment, see, I'll let you know what my supervisor and what the trauma therapist said, whether they think you're a good fit or not. And you can make the final decision on whether or not you want to go in.
Okay.
Does that sound good?
Mm-hmm.
All right. And keep going to the meetings, of course. Keep going to your groups.
Right.
And I'll see you next week.
All right.
All right, John?
Thanks.
Thank you so much.